Is the 17th of the 6th. Where's June going? This is Moth News Live, very special episode. It's a special episode because my name is Keith Walsh, by the way, in case I forgot to say that. This is a very important story. We're not breaking this news, but when Caoimhe Haughey got in touch with me and told me about it, I thought we should just get this out today. It has already been reported in the Sunday Times, which we mentioned during the interview, but very little anywhere else in the, whatever you want to call it, mainstream media, legacy media. So we thought we should get this out now because it's really highlighting this growing health crisis in Ireland. I mean, you're looking at the hip dysplasia debacle. You're looking at the care home crisis. You know, we've brought interviews with people who've had experiences with family members during COVID, you know, the hospital not knowing, you know, which patient was which, families being unsure if it was their relative that was actually in the box, in the coffin. Just, there was no oversight. Families didn't have any access, and that was COVID. But a lot of those things, as you saw in prime time a couple of weeks ago, a lot of those issues are still very much with us, and it just seems like with the children's hospital, the amount of money that's been spent on that, the hip operation debacle, which was closely followed by the HSE setting up a helpline and then asking the people who were manning the helpline to not say that they weren't nurses, which thankfully for somebody who was signed up to work on them and came out and told the rest of us about it, that news got out there. I mean, you just think we just need to stop. We need to stop with whatever we're doing with the children's hospital. We need to stop with whatever we're doing with the HSE, and we need to start again. The HSE is broken, and they're only making it worse. I mean, there's no other way of putting it. And how we're treated as people when we turn up at a hospital, how we're treated as people when we turn up at a care home, it's a direct reflection of us as people and where we are as a country today. And then how the families of those people who may have experienced some difficulties, there's been cases of assault. You know, when these families go to the government and ask for answers and have questions and want a bit of accountability and want a bit of oversight and want a bit of clarity, they're pushed away. So there's trauma upon trauma upon trauma. This has not been, the people who are running our care systems, our care institutions in Ireland do not know what they're doing. They're doing a bad job, and they seem more interested in protecting their department, protecting their institution, than actually caring for the patients. It's our money that's been spent. It's our money that's been spent fighting families in the courts, families who want answers about what happened to their loved ones. That's our money that they're choosing to spend in that way. And me personally, I'm not happy about that. I would like families to be able to come with their issues and sit down at a table and have answers and a bit of transparency, but you can't go into a care home because they're private, and apparently there's no oversight. HICWA have no oversight. They've no teeth. It's not good enough. We need better, and we should demand better. So this is new, and you may titter and it may sound funny, but this is a real issue. This is one that until now has been largely overlooked. You'll hear how long it's been out there. It involves cases of delayed diagnosis in male children, specifically a condition known as undescended testicles. There's a medical name for it that I did write down somewhere. I can't find it now. Undescended testicles. If you're a man, you'd probably be aware of this, because at some stage when you're born, your testes have to drop, basically. You'll have heard the phrase in the playground probably, or in work when you're a young man, and you come in and your voice breaks, and some older lad goes, "Oh, the old testicles haven't dropped yet." But this is a very serious issue. There are life-changing consequences, and it's lots of young men in Ireland who are suffering from it, and suffering in silence because of the shame. This isn't just a medical issue, this is a human rights issue, and I'll be speaking to, right now, Caoimhe Haughey, who is a solicitor with expertise in medical negligence. So she explains in the interview the impacts of undiagnosed cases and how they go far beyond the physical. You were talking about irreversible infertility, increased cancer risks, psychological trauma, and very serious consequences for a young man's right to have a family. Very basic rights. And what's even more concerning is that this is the first health scandal affecting an entirely male cohort in Ireland. So it'll be interesting to see how, how the patriarchy, or whatever you want to call it, deal with this. I mean, we saw what was said about the cervical check scandal, how we treated those women initially, what was said about them, and we do discuss that. So in this interview, talked to Caoimhe about the medical, psychological, and legal implications of this whole thing, as well as what needs to be done to ensure that such a critical issue is addressed before more lives are affected. We'll also touch on the systematic failures in Ireland's healthcare system that have led to this growing problem. Please, if you've had an issue, I think it's important that I say this, if you've had an issue with a care home, if you've had an issue, I mean, if you're a young man who has an issue with this thing, and you can't have children, you can't have a family, but you feel a bit of shame, if your loved one has been in a care home, if your loved one has been in respite and something has happened, it pretty much has to be affecting every family in Ireland now at this stage. These are not isolated incidents. This is how we are. This is how we run our hospitals and our care homes. This is what we do. And if you've been affected or you have a story, please do get in touch. But also, don't feel like it's just you. It's pretty much how the country is being treated, everybody in the country at the moment. So come on to Moth, tell your story. We've had lots of people on. You can look at our YouTube channel, have a look there at some of the interviews I've done over the last few weeks, and we've got a few more lined up. Just people who've had these experiences and are looking for answers, and are being, this word witch hunt was used, and I've used it myself, but the Taoiseach said it of these people who are looking for answers and can't get answers, that this is a witch hunt. I mean, I even mentioned in the chat with Caoimhe this idea of like a whistleblower, and I'm not sure how we look at whistleblowers, how we do as people. We see them as troublemakers, and sure, look, you just get on with your job and kind of stuff. But these are important people, and these people should be like celebrated, and they're bringing these things to light. And just because there's lies been told about them, and the establishment wants you to think that they're bad people, and they're doing this for a reason. And I've had my own experience with that. Whistleblowers are very important. So don't be afraid to speak out. This is happening a lot. This is happening too much. Please forget about the immigration thing. Please. That is not the problem. We have a huge problem that's not being caused by people who are coming to this country, escaping war, or escaping abuse, or escaping whatever they're escaping from. They're not the problem. Please, if you're marching about immigration, you are what's called as a useful idiot. And I don't mean, I understand that people have their reasons. I understand that people feel under pressure. I understand that people are stressed and they're worried. I'm not saying you're a useful idiot, but useful idiot is a term that is used when there's a distraction going on. People are causing a distraction which stops the citizens of a country or whatever from looking at and shouting out about and calling for changes with the real problems, which is our government at the moment. And they're making an absolute hames of things. An absolute hames. Like, you go back to Stardust, the mother and baby homes. This is what we do. We make a hames of something. We ruin lives. We do whatever we want. We allow these institutions to steal babies, to, for people to die, and we try and brush it off. We try and push people off. We spend money. Like, we must be a very wealthy country, because the amount of money we spend on legal teams defending the indefensible, protecting the institutions, instead of looking at the people of this country and seeing if we can do better. That's what we should be looking at. That's what we should be asking for. There's an issue when we go and vote and the vote seems ineffective, because it's just the same thing, the same people making the same decisions, making the same errors of judgment. Something has to change for the nurses. I'd even say for the guards, for people trying to buy homes, for parents bringing their children into hospitals. There is so much trauma being put upon the people of this country. We have a serious mental health issue, and it's not being caused by drugs, or I know it is in some cases, but it's not being caused by immigrants. It's not being caused by so-called illegals, or whatever you want to call them, people who are coming here for safe haven. It's not being caused by them. It's being caused by our very own government. That is the truth. So if a loved one dies in a care home, in a hospital, and you're looking for answers, you're already traumatized because you don't know what happened. You've lost somebody. There's grief. There's sadness, and you want answers. Well, guess what? They'll give you another helping of trauma on top of that trauma by ignoring you, not doing anything about it, making you go to court to prove that they did something wrong. I don't know why they're taking this advice from their legal teams. Somebody's making money out of this, but the wrong people are being protected. We're protecting the institutions that are broken, that are dysfunctional, that are causing untold damage to the staff, to the patients, across the board. Untold damage. The institutions are broken and they don't work, and they're being protected. We're spending money hand over fist protecting these institutions that do not work. We're protecting the indefensible. We're defending the indefensible, instead of just stopping and going, where are the patients in all of this? The patients should be, if you're a hospital, the priority. But as you'll hear in the conversation, it seems that doctors and consultants and people who run our healthcare system I don't even know if they're aware of the patients at all, because their priorities are elsewhere. Anyway, I could literally talk about this all night. I'll play this interview. If you have any thoughts, do get in touch. You can leave a message here, whatever platform you're watching. If you're watching on X, send us a message, and I'll pop up the details of our social media handles there in a sec. This is Caoimhe Haughey, solicitor, friend of the show, telling us about this new scandal, which she reckons is and will be the biggest healthcare scandal to hit this country. Now, that is quite a claim, because we've had some whoppers. Caoimhe, great to have you on again. Now, we're still supposed to have that conversation about the hip dysplasia stuff that's going on there. That whole, are we calling it a scandal? But something else has come up. I mean, it's just wave after wave of issues, problems, trauma being meted out by the people who are supposed to be caring for the people of Ireland. This time, CHI, we're looking at young boys. I mean, it's I don't know the scientific or the medical term, but undescended testicles. I actually think as a young boy, this is something that I had to have dealt with. So there's a big issue with that, and part of that issue is this whole thing where the Gardaí may be having a look into the misuse of funds and how that has also caused a knock-on effect to this and other patients as well. You mentioned the phrase Crumlin orphans, so we can get to that as well. So tell me about this new thing that, I mean, you called it possibly the biggest health scandal to hit Ireland, or like, are you talking about in recent times, or?
Yeah, well, when I first saw this coming to light as a result of the fantastic investigative reporting of John Mooney of the Sunday Irish Times, I just I felt a chill going down my spine, Keith, to be honest with you, because as it happens, I'm doing a case in the office. Now, it's nothing to do with this latest scandal, but it's for a young man who, at birth, what we say in the case is that the pediatric assessment when he was born failed to detect the fact that his testes had not descended appropriately. I'm sorry now if I'm using language that is sensitive and fairly stark, but had not descended into the scrotum, into the sac, shall we say. And so this went on, and it was only when he reached male adulthood, and he was with his lovely wife, and they were, starting a family and going through all of that. And issues arose, and then checks were being done, fertility testing, etc. And then out of the blue, bang, he discovered that he was infertile, because this condition had remained undiagnosed for all these years. And one of the consequences, which we know about, which is alluded to in the various subsequent media reporting, I should say that it seems that this report, it seems to be in the hands of many media outlets and seems to be completely in the public domain, but yet our Minister for Health and our government are still refusing to publish it. This is causing huge anger and a lot of upset amongst patient advocates, particularly the Scoliosis Advocacy Network, the Spina Bifida and Hydrocephalus Network. But back to this case. So essentially, if this is not treated, firstly, if it's not diagnosed, which happened in this very tragic case, but most importantly, if it's not treated within a certain time window, which is 9 to 12 months, the possibility is, or the likelihood is, that the damage will be done. There is no treatment then. And what it will lead to is infertility in the male, in the boy, and the consequences of that, obviously, for his future. But not only that, there's a risk of cancer. Then there's the necessity of hormone treatment. There's the psychological damage. There's denial, many constitutional rights, for example, the right to bodily autonomy, the right to bodily integrity, the right to have a family. I mean, this is, in my view, to answer your question, a scandal of massive proportions in terms of the damage done. To think that as a child, all of these things, all of these rights that one grows up and expects to have, automatically fundamental rights, just taken away from you because you've been left on a waiting list and not treated in a timely fashion. It's head exploding for me. And for the first time, this is a health scandal that is purely and only affecting our male population. We've had so many scandals, the Hep C, cervical check, mother and baby homes, essentially affecting women and children. But this is the first time that this is a health scandal affecting the male population. And I don't think that has ever happened in Ireland. And it'll be very interesting, in my respectful opinion, to see what the attitude will be to this. I mean, as we know, in cervical check, there were very strange, odd attitudes in the early days, uncovered by Dr. Gabriel Scally.
Sorry, to take my headphones off there. Carry on.
Dave, you remember Dr. Gabriel Scally who did the cervical check scoping inquiries, and he came out very strong in the very early days and described a culture of misogyny and paternalism in the healthcare system. And I always remember one quote that he stated that a lady he had interviewed had reported that a doctor she met when she was, getting her diagnosis, well, nuns don't get cervical cancer. I mean, I don't have to tell you or your audience the
How
meaning,
disgusting that.
the prejudice behind
Yeah.
that. So here we are now with a healthcare scandal affecting our male population. So I'd be very interested to see what the patriarchs out there have to say in relation to this, and particularly what apparently is coming out of this report from CHI. I mean, I've seen language that the use of the word abhorrent, toxic, bullying, people afraid to speak up, a defamation case apparently with two consultants at war at each other. And all of this has resulted in apparently a general surgery, oncology general surgery service within CHI at odds with a urology service within CHI, and mismanagement of lists. Apparently now as well, we're finding out mismanagement of funds from the National Treatment Purchase Fund. So patients, boys, baby boys have suffered, and the life-altering consequences of what they have suffered is, as I said, it's mind-blowing.
I mean, as you're talking there, it seems to be becoming more and more apparent that a lot of the issues that we're seeing with scandals, talk about the hip operations, talk about, anything to do with the HSE or to do with the CHI or any of these, a lot of these government departments, institutions, whatever you want to call them, are caused by, in this case, like you're looking at misuse of funds, but a lot of the times, like interdepartmental politics. Like I don't want to speak out of turn, but I can remember having a conversation with somebody who was involved with a government department, and they were talking about their HR section, and that person who headed up that HR section actually said the phrase, my first concern and my priority always is for my staff. And I just felt like that, to me, having heard that so many years ago, and then seems to be the culture of looking after your patch, of fiefdoms, of people trying to get somewhere. People, I mean, with men, a bit of dick waving, power play. Do you know what I mean?
Yeah.
That seems to be a much bigger issue and much more important and much more prominent and much more important to the people involved in these places like the CHI and the HSE than the actual care of the patients. The patients are coming last every time. This is a huge, huge problem. And you're talking about egos over healthcare. You're talking about money, finance, people lining their pockets, people wanting more, greed over healthcare. And now, as you're saying, we have another massive scandal where I've interviewed men who have gotten to an age in their life where they want to have children, they can't. I know the psychological damage. Yet again, we're talking about mental health, mental health care, mental health being affected adversely by the people who are supposed to be supplying the care to this country. It absolutely boggles the mind.
No, 100%. And I think what you've said there is kind of struck me in that in the last couple of years, there's a common theme that has emerged from the various scandals affecting CHI. First we heard about the surgical springs, and then obviously the hip dysplasia. There is another issue that apparently has arisen with gastro buttons. It's been lightly reported, I think, in the media, not something I'm terribly familiar with. But now we have this in relation to the failure to treat the condition of undescended testes. And I think what has emerged from the reporting that we've all seen, Keith, is that at the back of this, there is this ego of consultants and, as you say, fiefdoms and minding my patch and making
Looking
sure.
after my own and
Yes, my own. And
more concerned with who's getting what job and who's moving where, and these kind of issues seem to be much bigger in their worlds than the care of the patients, which is the job. And it just seems like I can't not see it. Like it just seems, the more I see it, the more it proves itself. Do you know what I mean?
Exactly. It's like a self-fulfilling prophecy. The other thing which I think is really important for your listeners to note is that, well, two things. Firstly, apparently this issue with regard to the undescended testes was first was highlighted back in 2008, and apparently there was another report called the Dixon report. I'm not even familiar with it, to be honest with you. I'm still doing my own research into this, but concerns were raised at that stage because there was a question over children being transferred from Crumlin to Temple Street and then not having the appropriate follow-up surgical service in the transfer. So they kind of got lost in the system. And I think this is why we have this Crumlin Orphans terrible title. But in addition, apparently our maternity hospitals, 5 years before this whole issue came to light, this report we're talking about, I think it was eventually completed in 2021. So what are we talking about? Maybe around that time, 2016, 2017, 2018. That the maternity hospitals, because obviously children are born in maternity hospitals. When you're born, a pediatric consultant or doctor or registrar, their job is to come in, 10 fingers, 10 toes, and in the case of a little boy child, obviously that they have their genitalia, everything is intact. So they expressed concerns about referring children on, or boy children on, and they were not being treated in a timely fashion. They weren't getting the intervention. So the maternity hospitals were raising this 5 years before this report was ultimately completed. So, what is going on in our healthcare? I mean, why is it always elderly people, women, and children? Why? Why? Is it because they are the vulnerable ones?
They're easy to. I don't know. It seems to be it seems to be a historical thing with Ireland that we just can't shake, is this treatment of women and children and the elderly. And it's always been this, and it's never, this is who we are. This is how we treat children. But like, I'd be reluctant to paint consultants and doctors and the healthcare system with the same brush. But
exactly. I want to say that because, look, there are so many good people out there, and I'm very privileged to say I have friends in the medical profession who I utterly respect and who I completely regard very fondly, etc. But there are the rogues. I'm sorry, and it's been proven, or not proven, but it's emerged from the surgical spring scandal, the hip dysplasia, and now this. There are rogue surgeons out there who are getting away with this arrogance, this misogynistic. I'm not saying that out of turn, but this, it's my way or no way.
It's the old, and obviously not so old, but it's the old patriarchy, and I'm a doctor. And we used to see it with our own GPs, or, the standing in the community. You're talking about the local priest, the local doctor, the power they wielded, and this idea. And as a country, we almost give that to them. Do you know what I mean? They're the untouchables. And it's time we looked at that.
They shouldn't be, because, apart from the harming of patients, and children patients, but they're also doing terrible damage to those young doctors, trainees coming up through the system. This report is littered. Apparently there was 49 people interviewed, and the majority of them all talked about this abhorrent, this was the word used, toxic, bullying, can't speak up, humiliated, demeaned, spoken down to, as a result of which Apparently, numerous clinical nurse managers left. You know, the mental health issues have arisen with the trainee doctors. I mean, they work hard enough, 80 hours a week, and having to deal with this. I mean, the destruction of the system, all at the hands of one or two or three or four rogues. I mean, the management. Where is the management? And
they don't. We've talked about this before. They don't have the teeth. They don't have. There's nothing they can do. They're untouchable. You have these ego-driven demigods strolling around hospitals, being absolutely, just at the basics, just being rude, difficult to work with, arrogant, and like we look at our nurses again, and we're going, the nurses are getting this in the neck again. And then we have to look at all of the problems in healthcare in Ireland. Like,
but it's,
are they all these being caused by the few?
Well, yes, and I think it's like in any organization, you have the boss or the CEO or whatever you want to call it, and you lead from the top, okay? And like people should be able to come to the boss or the CEO and say, look, there's a problem here, and it should be dealt with, not swept under the carpet because the boss is afraid to speak to his number one managing director or whatever it is. I mean, I'm using very kind of basic examples.
Yeah.
But at the end of the day, the money that has gone in to setting up CHI, which first came into existence in 2019, prior to that, Crumlin and, Children's Hospitals, Crumlin, Temple Street, there's an element of Tala, we're under the HSE. Now, I think I've mentioned this before, Kappa, where a lot of the hip dysplasia surgeries were done, is not part of CHI. It's a separate hospital. But yeah, so CHI, a lot of money was put into establishing CHI. And this was obviously in anticipation of the new Children's Hospital. It was felt it was appropriate to kind of take the management division, the management care of children out of the hands of the HSE and have a kind of separate sister HSE organisation to manage the provision of healthcare across Ireland for children. So we had a CEO, and I'm going to name her, Eilish Hardiman. Okay, she was in charge from the beginning, Keith. Where is she now? She oversaw and was there when all of these scandals were erupting, were under her watch, brought to her attention. And where is she now? Sidelined, thanks to Stephen Donnelly, former Minister for Health, into a nice new job where she doesn't apparently now have to answer any questions for her oversight and her management of CHI for these crucial years when she knew what was going on. And she seems to have done nothing about it, including taking to task these these consultants and or doctors who seem to be running what you've described as a fiefdom.
I mean that whole thing that you can, and this is very Irish, that you can do a job for a few years, you can make an absolute hames of it, you can affect lives, you can affect people as well. You can have the adverse effect. You're brought in to head up a system of hospitals. Ultimately, it's all about care for the people of Ireland. This is our money. It's the taxpayers' money that's funding this. The doctors are supposed to come out and use this money to care for the people. That's the agreement. That's the contract. That's the social contract. So to be in that position, to have been so terrible at your job that you're affecting lives, and to then I feel like this is very Irish. Just move to a different job and refuse, or not even refuse, but like not even, by law almost, you're the legal expert, by law almost not have to answer any of the questions. Like I'm just going to run away from this now, and I'm going to just leave this burning dumpster pile, this fire that will never go out, behind me. And just so then nobody is answerable. And to me, when you've got a situation, I mean, you'll have come across companies who, if you try and bring an action against them, and then suddenly, well, we're not actually the company, that's the company over there, and the money goes through there, but like that, he's actually this, and actually that this, and there's some PO box in Belgium or Brussels or something, and you can't find out who is responsible. It's really difficult to take people to task. That, when you think about companies who do that, you think, oh my God, that's so corrupt. That's a terrible, that should be illegal, whatever. When it's your government, when your own government are doing that thing where they move people, where the 3Ds that you've spoken about a lot, and we in Ireland, I know it's a term, but this term whistleblowers, which I don't really like, because I'm like, it's almost like a bad thing that, like, oh, the whistleblowers, and the Irish public are a bit like, bloody whistleblowers. The media have managed to create this impression of a whistleblower, fueled by lies being told, by places they've worked with. This idea was, these are just people who are who work in a place and are going, this is broken, this is bad, and they're almost, the whistleblowers in Ireland should be the heroes, and they're on the edges of our society. Do you know what I mean?
No, they are.
This is all bad.
It is, and I kind of think you wouldn't have this in the private sector. Well, maybe. Well,
you'd be fired if you did a bad job, first of all.
Yeah, and it's like if you look at the whistleblowers, and thank God for them.
Yes.
And I know a few of them.
I only hate the term whistleblowers because it's become a kind of a bad thing almost. Like, these are great people.
Yes.
We should be encouraging these people.
Exactly. And so it seems, Keith, from what I know, is that the majority of the whistleblowers are coming from state, semi-state, and predominantly HSE. So that's all public. So what does that tell you about the way, let's just stick with HSE and the CHI. What does that tell you about the way they're being run? That people feel so torn, their conscience is getting to them. They're going in and out to work every day. They're seeing these practices. They're seeing patients potentially being harmed. They're seeing their colleagues being bullied, nurses around the corner crying, somebody in a room having a panic attack or whatever it is. And they feel compelled to speak up and speak out. And it's endemic within the HSE and now clearly within CHI. So it's like it's rotten at the root.
Yeah.
But it's been going on for years, and nobody seems to want to take it to task. And this big word that I love using, accountability.
Transparency, accountability. Who's responsible for this? Who did this job? Let's, like, it's the thing of we go back to the civil service or the job for life, that you can't be fired. I worked in RTE, and I saw it there, where I was contractor, bogus, self-employed. But if you got to a certain place, you didn't have to really do a good job. You just had to stay to collect your brilliant pension.
Yeah.
That is as you mentioned, the private sector, you would get fired. I worked in radio in the private sector, and if you're not doing a good job, you'd be fired. I mean, I was fired because I was only on a bogus self-employed contract with RTE. I was fired.
Another major controversy in itself.
Yes, exactly. Yeah, and I mean, you're looking at this, and it's every department. I would talk about the culture in RTE, and it's brought about by this. People clocking in, people on holidays for 6 months, people just asleep at the wheel, just no interest in the job. Like so if you look at RTE, and I always think about the content. So RTE are there to provide content, news, current affairs, comedy, whatever it is. Just like the HSE and the CHI, the content with RTE is the very last thing anybody thinks about, because there's a huge concern over the pensions. there's huge concern over position. There's huge concern over ranking. There's that fiefdom thing where it's like company politics. What actually is going out? I'd say half of them don't even know what's going out on the television. I'd say half of them don't even know what's going out on the radio. Do you know what I mean? And it's the same thing here with the HSE, the CHI. The last thing, the most important thing, the reason they're there is the care of people, especially women and children in this case, because men seem to do okay. Although, maybe that's unfair. But the care of the people of Ireland seems to be the very last concern of the people involved in running these places.
I think you're right. It's like they've lost sight, of why they're there. Yeah. I mean, my mom used to talk about if you wanted to be a nurse or a doctor, that was called a vocation, Keith. You never hear that word now anymore. Vocation kind of conjures up dedication, care, conscientiousness, all those kind of very important words if you're working in the care industry. But that seems to be gone. Mm-hmm. But I blame management here. I blame the system. Mm-hmm.
Because at this stage we've got young doctors and nurses, and everybody that works to keep the hospital going and is at the coalface, is meeting the patients every day. They're in survival mode. Yeah, these are all trauma. You're talking about traumatized people.
Yeah, and I mean, we've built, well, we haven't finished it yet, the most expensive hospital in the world. And, please God, it'll be opened in the next 12 months or whenever it is. If that
I won't be holding my breath, though.
Down the road. But what really concerns me, in light of what's gone on with CHI over the last number of years, is how do they expect to bring all the disciplines, the consultants, the surgeons, the nurses, the physios, the healthcare workers, how do they expect to bring them under one roof and expect them to bed in and settle down and go, oh, that's great. We're all now working together. We've all got to share theatre space. We've all got to,
have an understanding of each other's difficulties and processes and try and fit into that and work with each other. Yeah.
But like all we're hearing lately is toxic and, a culture of bullying and I can't even think of the words.
Well, people working in very difficult circumstances, nurses. I mean, you see, then the knock-on effect then is like our nurses and our guards and people like that aren't earning enough to buy a house because of the housing crisis. And we're talking about a traumatized country. We're talking about people surviving on their wits. We're talking about people whose mental health is at its lowest because, and it's not because there was times in Ireland when we didn't have enough. There's times in Ireland when we didn't have money. Yeah. It's the difficulty now is we seem to have money. Yeah. But we still can't do anything.
But it's been
we're slaves to the job. We're slaves to the mortgage. We don't have time for our children. We're at our wits' end in work. We're talking about traumatized and people in survival mode in hospitals and Gardaí. Like, this is the state of this country. This is when people feel like something feels off at Ireland at the moment. There's something wrong with the energy. You're looking at marches, people pointing the finger at immigrate. This has been created by the way the country's been run.
Yeah, no, to me, it's all about big business, big tech, big pharma. It's the top of the triangle. It's not whatever about the middle, but it's certainly not on the lower, the foundation, level of the triangle.
Yeah. Get the basics right.
Which is what supports an economy, which is what supports social cohesion, which is what supports communities. It's base, as you say, the Gardaí, the nurses, the teachers, all of those who are providing an invaluable service to keep our society, our communities going. Yeah. And they're just being left to struggle, cost of living, non-access to healthcare, or timely healthcare, sitting in A&E departments for hours on end, you know.
Everything is a struggle. Everything is
Everything is
and then I suppose we'll get back to the specifics of the conversation, but then when we've spoken about the care homes in Ireland, when you've had you've had a bad experience with a care home where something has happened, we had all those people who died that probably shouldn't have died during COVID just because they were old. We say, well, look at, which to me seems like a dreadful, that's a stain on our copybook as a country. But it's when you try, and even in England, they're doing, in the UK, they're doing this better. When you go and try and get answers and some information and make a complaint, then on top of the trauma you've already experienced, the government will give you some more trauma by pushing you away, calling you a witch, it's a witch hunt, whistleblower, all these things. And that is just, we're traumatizing our people in the first place, and then we're re-traumatizing.
Yeah, it's a demoralization and a dumbing down a lot of the time, that if you speak up, you'll be punished, you'll be alienated, or we'll do the David and Goliath on you, we'll rally the forces, we'll get out the big guns. So it just seems like a tsunami coming at you, like, how can I fight this? How can I keep going? I'll just give in, But I do feel, Keith, that there's a lot of moms and dads out there right now, the surgical spring scandal, the hip dysplasia, and now this. And I feel a very strong sense of anger. And we've had enough. They've had enough, Keith, moms and dads.
I think so, and I think that we talked about before. If the HSE or if they're trying to, and the government trying to say, well, that's an isolated case, that's an isolated case. When you put all these things together, everybody everybody's been affected by the mismanagement of our care system in Ireland. Everybody, and it's almost like there's a shame. People don't like to speak out. You don't like to put your head above the parapet. You see how whistleblowers are treated. You see how, if a nurse speaks out, people are. But I think there might be a moment here where everybody goes, hang on a second. This is all. So this is you, my neighbor. We're all struggling here, and there's a tipping point on the way. I think you're right. How many people do you think are affected by this this particular scandal? Have you any idea or?
From what I can tell from what I know of the report, I think up to 200 charts of patients were looked at. Now, what's come out of that, I don't know, but the period, I believe, was like a snapshot between December 2020 and March 2021, which is only 3 months. And I think up to 200 charts were sort of picked, if you like. And then the children, obviously the boy children, what happened to them thereafter was assessed. For example, how long did it take them to get off the waiting list, to get in to see a consultant or not? And I think what has come out of this report, which we've already addressed, and this goes into the issue with the National Treatment Purchase Fund, that many children were still on a waiting list after a certain period of time, which this report has concluded was not acceptable and was likely to lead to harm to the patient.
And I suppose we're in this period where the government will try to not talk about it and not discuss it and deny it for a little while until they have to, and then 10 years down the line they come out and have to make a public apology. Just make the apology now. Talk to people. Be transparent. Stop doing if you do the same thing over and over again, it's like you've lost your mind. The country has lost its mind. We need to change how we do things, how we treat people, and it will pay dividends. Forget about money. Forget about the celebrity companies and the glamour. Just look after the people, and it will pay dividends. I know you have to go, so
No.
I appreciate your time, but just there's an Oireachtas committee meeting? Is that today or tomorrow?
So I think HICWA is in today, and I think CHI is in on Thursday. And I think I've seen somewhere that the list of personnel for Thursday is very interesting. It's the clinical director of Temple Street, also the CEO, current CEO Lucy Nugent, and surprise, surprise, the former CEO Miss Eilish Hardiman. So I think everybody should be tuning in on Thursday to see what happens, what questions are posed, and what topics, because there's a lot to discuss. But just to maybe finish on this point. I've mentioned the Scoliosis Advocacy Network Group and the Spina Bifida and Hydrocephalus Advocacy Group and the 4 girls. They're just fantastic. And they're clearly very close to all of this because, as I mentioned earlier, Spina Bifida children are part of this report. And apparently what has come out now is that this report has concluded open disclosure was not carried out, as there is no, this is what it says, no significant scientific evidence that delaying treatment will equate to patient harm in this patient cohort. When asked if this comment also includes children described in the unpublished report as orphans, the Crumlin orphans, among children in the waiting list clinics, a spokesperson said, the highlighted line includes all relevant patient cohorts. So what is CHI saying, Keith? Which is it? You know, this is more of it from CHI. There's confusion, obfuscation, you know, trying to twist the narrative. Publish the goddamn report. Contact the families who are implicated in this report. Bring them in. Do proper open disclosure meetings. It's in the Patient Safety Act of 2023. Why this ducking and diving and parsing of information? It's only going to make moms and dads more angry, more determined, and the government would want to really pay attention here, because angry moms and dads are not what we need to be dealing with. They've enough to be getting on with the cost of living crisis, struggling with everything they're going through, you know, other issues with the economy, but the health of their child, I think that is a tipping point.
Yeah, I mean, you know, you wouldn't want to be calling for people to down tools for a couple of weeks.
No.
But you know what I mean? It's the, once again, we're putting egos and departments and institutions, the protection of those before the protection of our people. Yeah. Why are we protecting the few and harming the many? It's upside down.
Exactly. Yeah.
Keith, thank you very much. And should we talk to you next week? Maybe once. I mean, the story will run and run, as they say.
I think so. I think there's a lot more to come out, Keith. I'm sorry to say it, and I don't think it's going to be good.
No, but like, you know, it's we need to get it out there. You know, and talk about it. Thank you very much.
Thank you so much for having me. Take care.
Talk to you soon. I'm so angry. I forgot to turn my mic on. Just publish the damn reports. Publish the damn reports. How many times in this country do you find ourselves? A scandal emerges. It's early days. The government try and kick the can down the road. They don't want to deal with it. They want it to be someone else's problem. It's the not on our watch. It's the NIMBY, not in my, whatever you want to call it. They want to wash their hands of it, and they won't just face. It's not. There's no shame in putting your hand up. We want leaders in this country who are willing to put their hand up and go, yes, this is a problem. We messed up. We're going to put it right. We do not want, I personally, I don't know if anybody agrees with me, I do not want taxpayers' money, to which I contribute, being spent on legal teams fighting families whose loved ones have had trauma, or their loved ones have died, all at the hands of our care system. I do not want my money spent on legal teams to fight these people to stop them getting the truth. That's not what I want. That's not what we're about. That's not what we should be about. That's exactly what we are about. But anyway, so thank you very much to Caoimhe for talking to me. Just to sort of explain, if you joined late, what is this thing? It's a scandal. It's possibly the biggest scandal to hit this country. So it's Undescended Testicles. It sounds funny. Cryptochidism is my pronunciation of it. It's a medical condition where one or both of a male's testicles fail to move down into the scrotum before birth. This is not possibly for the squeamish. It's a common condition in premature babies, but it can also affect full-term infants. In many cases, the testicles may descend on their own during the first year of life, but if they don't, medical intervention is needed. And this is something that the HSC have always done by rote, like just it's a part of it, of the service. It's what you do. It's what you look after. You make sure that during the checkup that the testes have descended into the scrotum. But because of, well, who do we blame? We don't know, because there's no transparency. But because of whatever, maybe consultants, maybe the system, maybe the setup, maybe the bureaucracy, because of the waiting lists, these young men, and there's a lot of them, weren't seen within the 12 months. So when it's left untreated, the undescended testicles can cause serious long-term health issues. The most critical concerns are infertility, as the testicles are unable to function properly in higher body temperatures. There's cancer risks, because the undescended testicles are more likely to develop cancer later in life. And of course, there's the psychological, mental impact, because this condition can affect, if you can't have children as a man in a country where you're told that you should have children as a man, it's going to affect your self-esteem, your body image, particularly as the child grows older and becomes aware of this, and as a young man or as a teen or whatever. So this is a very, very critical thing, a treatment that so many young men have missed out on. And it affects their bodily integrity, bodily autonomy, both of which are fundamental human rights. So if it's not diagnosed and treated properly, it can also severely affect their ability to have a family in the future. And the medical costs then, you're talking about surgery to fertility treatments. These are not cheap things, placing huge emotional and financial burdens on families who are already burdened. We want people to make that choice, have families, don't have families. This is too important to miss. Anyway, now we're shifting gears slightly, but not really. We're going to turn our attention to the other failure to care in Ireland, this time within our care homes. We've spoken a lot about this, but last Thursday I spoke to Caoimhe after she was at the Care Champions protest, which was organised by Majella Beattie and her pals, her colleagues. It was outside the Dáil last Thursday. It was Majella. We've spoken to Majella, a passionate advocate for families affected by nursing home negligence. Caoimhe, who was there and has been closely following the developments and has been working with these families and taking these cases, because you have to take a case against the government. You have to prove that they did something wrong, because they will just sit on their hands until you find the money to get a solicitor to take them to court, to wait the 5 years of trauma and trauma and trauma upon your already traumatized family and body, and because that's what you have to do. So Caoimhe is doing that with these families. And during the protest, there was emotional stories from families, who had some stories about COVID-19 incidents during COVID-19 in care homes. And anyway, so Caoimhe was discussing this. I played some of it out on our live show on Friday. You can watch us live. It's basically a roundup of the news of the week. A lot of scandals, would you believe, in Ireland at the moment. You can watch us live every Friday from 3:00 for an hour. But yeah, a bit of this went out last Friday. I wanted to play the rest of it because the mind boggles, you know.
Caoimhe, how are you? Thank you very much for joining us on Moth News again. You were so good the last time we had to have you back. You've just come back from the Dáil. Can you tell me what was happening there today?
Yeah, so thanks so much for having me. I'm really grateful to be back. Appreciate us having this chat. So yeah, Care Champions organised a protest outside the Dáil earlier today from 11 o'clock in relation to obviously the latest scandals that has emerged vis-a-vis private nursing homes in the state. And the protest was headed up by Majella Beattie from Care Champions, who I don't know if you know of Majella. She's just the most wonderful woman.
Yeah, we interviewed Majella here. She kind of kicked off the whole our series of, we went on to do a series of chats with people who have been affected by whose loved ones or friends or family or themselves have been involved in traumatic experiences with care homes in Ireland.
No, she's an absolute powerhouse, and she's so insightful and so thoughtful. I mean, everything she does is volunteering. So Majella was there, spoke very powerfully, and then there were some other lovely men and women who spoke about losing their loved ones back during the COVID disaster with nursing homes. If you remember the very high level of deaths during March, April, and May of 2020. And then there was another lady, honestly, you couldn't hear a pin drop as she spoke. She spoke so powerfully. Her name was Yvonne, and she was talking about her mother, who only died in horrific circumstances last year as a result of absolute neglect in a nursing home in Dundalk. And the whole protest, when the people were speaking, I suppose protest is not really the right word, but we were there in solidarity with each other. And it was just very edifying for me listening to these stories again. And, the people speaking, very powerful. And actually our friend Louise Hassan also spoke about her daughter, Caitlin, because I suppose it's not just about nursing homes, it's also obviously residential care homes, respite homes, that come within this ambit of social care, which is the way Majella described it. Majella spoke very passionately about the fact that our country now our government has sold our social care and nursing home care to private companies, which she described as a model for profit. It's not a model of care. I would absolutely agree with that. She used phraseology, for example, that our elderly people are being warehoused in nursing homes, and that there's no proper oversight, that HIQA really does not have the proper resource for doing an inspection.
Grant. So I don't need to the first bit. So if you want to say
Care Champions protest outside Dáil Éireann, and this was I suppose in light of the desperate, horrific scandals that have emerged in the last week or so in respect of the EMEUS, I'm not sure how you say it, nursing homes, Benavon in Dublin, and I think the residents in Portlaoise. So there was a great gathering outside the Dáil, and these are familiar faces, fantastic people that I've met over the last number of years. As you probably might know, Care Champions kind of set itself up voluntarily during COVID and offers great support now to families who are dealing with nursing home issues, residential care issues, respite care, etc. And Majella is an absolute powerhouse, along with her team, volunteering all the time as a source of help, advice and support. So Majella was there, spoke very powerfully, and made demands in relation to the government's failures, one, to enact what has been sitting as a bill for the last 7 years as safeguarding legislation. Really, what is the explanation for that sitting on the books for the last 7 years? Number two, really importantly, this idea of care partners. So in other words, you have a care partner, like a husband and a wife or your partner, no difference, but also then critically mandatory reporting, which doesn't exist at the moment. And these are the three calls of action demands that I picked up today. But Majella spoke very powerfully. It was very edifying, to be honest with you. People kind of fell into silence whilst they were listening. Majella described what is going on in Ireland at the moment is that our government has essentially sold our social care to big private companies for profit, that they're running our nursing home care as a model for profit, not a model for care. And she described that our elderly people are like being warehoused in these private nursing homes, and very much putting this neglect, this constant evidence of severe neglect. And one story seems to be worse than the other. I mean, there was a lady there today, again, everybody fell silent as she told the story of her late mom. She had a picture of her mom in relatively good health, and on the other side she had a picture of her mom when she fell into an absolutely shocking state of health. And this poor lady ultimately died. But this lady Yvonne, her mom was in a nursing home in Dundalk, again a private nursing home. And what is really stark in light of what we're hearing about the recent scandal and HIQA's inability to, sanction, discipline, etc., is that this lady put together a folder of information by way of a complaint. Even though you can't make an individual complaint to HIQA, they won't deal with it. But she had put together really valuable evidence about what she had uncovered in relation to her mom. It was utterly shocking. And she followed up with HIQA when they were about to come in to do their inspection and complete their report. And they told her, which I couldn't believe, she said it today outside the door. So when I asked HIQA, had you taken into consideration the information I provided you with? The answer was no. We didn't consider it in the course of doing our inspection, compiling our report, and essentially tick boxing this nursing home as compliant. Now, I do respect HIQA, I do, and I understand what their function is, but I've said it before, I'll say it again, they have no teeth. All they do is go in, do inspections, gather together information, write up reports, compliant, tick, substantially compliant, tick, non-compliant, tick, make recommendations, and that's it. The CEOs and the owners of these private nursing homes, they're faceless. We don't even know who they are. These are the people who need to be called to account. These people need to sit in front of the Oireachtas Committee, in my opinion, one after another, to give an account. How are you running your nursing home? Are you complying with legislation, health and safety legislation, not just for patients, residents, but also for your employees? And HIQA needs to be given more powers immediately, or some other body, regulatory body set up, that if there are breaches and people are reporting issues, and this is into the mandatory reporting, that there is sanction, there's disciplinary action. And what An Taoiseach said yesterday in the Dáil, which I thought was very interesting, fines, penalties and fines. And if we don't do that, we're still going to be back. We've had Lee's Cross, we've had the desperate level of nursing home deaths in such a short period in 2020 during COVID, March, April and May, and we all know about that tragedy. And here we are now, 5 years post the start of COVID, and we've this latest scandal with nursing homes. It's all down to neglect. I think we have nearly 600 nursing homes in the country, but significantly, and this is what Majella Beattie spoke about today, is that 81% of our nursing homes are in private ownership. So that means there's even less lack of oversight, accountability, transparency with these private nursing homes. And one thing which frustrates me no end in the work that I do is nursing homes are playing a game. Private nursing homes are playing a game with families who want to get access to their loved one's medical records. If their loved one has passed on, is deceased, they're refusing to give them, and they are quoting that they're exempt from providing access to medical records because the FOI does not apply to a private body, freedom of information, and number two, GDPR only applies to living persons. Now, I'm about to bring two motions before the courts, hopefully in the next number of weeks, in relation to one nursing home franchise. I won't name it because it's going before the courts, have a firm of solicitors who have been torturing me for the last year. Every time I've said, please be reasonable, I need voluntary discovery of these records. No, no, no. Delay, deny, defend again. So now I have to go to court. I have to explain to my clients, unfortunately, we have to now air this in the court. We have to spend money getting it into court. I have to hire barristers to advocate the application, and there'll be a fight. Now, this is utterly, utterly indefensible conduct on the part of these private nursing homes. And as I've said, they're faceless because they're big companies. You know, MES, I think, is from French origin. So we don't know who they are. We don't know who's running them. We don't know what type of money they're making. And yet they are treating our elderly like inhuman. It's inhuman the way they are treating our elderly. You did ask me to think or to talk about, I couldn't watch that documentary on RTE. I simply couldn't. I cannot get out of my head that poor gentleman being rough-handled, pulled up by the back of his trousers and marched along a corridor and then pushed into his room and literally shoved into a chair as his trousers are being pulled down. I mean, it is just beyond. I just can't look at that kind of stuff. And I'm sure there's many of your listeners out there, and these are families whose loved ones are in nursing homes, must have been devastated seeing this type of conduct going on. Unchecked, unsupervised, unregulated, and no accountability.
But how from a legal standpoint, I mean, how can it be a thing that we are like our parents, our grandparents, family members are going into these care homes, and it's only then really that people realize that HICWA or there's nobody. We don't have a. I mean, this is us. Like, this is us. This is the Irish citizens. This is our country. This is how we are treating people. This is not. I mean, obviously, these private companies running these care homes are doing an absolutely terrible job of it, and it's diabolical. But this is us. This is our country, and this is how we are treating people. Our government. This is when families look for answers. You mentioned there, delay, deny, defend. There is no meaningful conversation. There is no. They don't want to hear what your experience is. They don't want to know. The Taoiseach at one point, I think, used the term witch hunt with regards to the families who were looking for answers to how their loved ones were treated during COVID. I think he wasn't the only one. I think it might have been said 3 times, maybe by the Taoiseach, maybe by the Taoiseach, maybe by another minister. Witch hunt. This is how we are treating people, and it's not. And I'm sure you know, because we will get onto the hip surgery debacle in a minute as well. But it's not the government for a long time, and especially if you look at the HSC, they're going, oh no, isolated incident. Oh, that's a one-off. This is across the board how we do things, how we look after people across the board. Our whole care system, from the HSC to care homes, is in
shambles.
It's a shambles. It's broken, and there is no, like, the whole thing has to be taken down. Start from, because, you know, if I was you, I wouldn't start from here, because and surely at some stage, like, you must be seeing it every day. This is you work in this area. You must be seeing day after day after day, story after story after story. I've only been looking into this. I've only been looking at this in the last month, and I'm appalled that this is happening. How are we here? Like, I mean, it's not just what happened in COVID. What happened in COVID has continued. We're still doing it. We're still not giving people access because, oh no, there's a bug going around. Oh no, there's a bit of a flu. You can't come in and see anybody. They don't want people coming in. You're talking about care partners. Super idea. We should have done it during COVID. They don't want people coming in. They don't want people looking around. What does that tell you?
You're so right on that point, because that was something else that kind of struck me today. There was another lady talking about that very point, that, you know, years ago, if you had a loved one in a nursing home, okay, there might have been a vomiting bug or there might have been some issue, but it didn't mean the place closed down and the shutters came up. It didn't mean that. And now they're using this as an excuse to stop people coming in. And I'm sorry to say this, but this is to stop the vigilant family members, the ones who are, watching, seeing they're there regularly and they see that the bathroom is not being cleaned or the bins are not being emptied or there's an issue with medication or even worse, their loved one is beginning to develop a bed sore. This is a huge issue in nursing homes, bed sores turning into ulcers and turning necrotic. This is what can happen with an ulcer. And this lady said today that she's not wearing it. She's not putting up with this excuse, oh, we've a vomiting bug, or we've got some little issue going around. And even if we do have God forbid we have another pandemic like COVID, I can tell you one thing, these families will not tolerate being told I can't go into the nursing home, not just to see my loved one, to check my loved one is being looked after. It won't be tolerated.
I mean, I spoke to I won't give her name, but you can watch back on all her videos on YouTube just in case I get some of the details wrong. But that she was being sedated. Her mother was being sedated. She had mentioned that her mother maybe might have taken half a pill, trimazepam, or some kind of sedative before she went in. Might have taken one every couple of days to help her sleep, whatever. This woman then was starting off on sedatives in the morning, and but there was no oversight. The family weren't told in advance. It seemed to be pro rata. This is what happens when they come in. We sedate them, we keep them quiet. I mean, the stories are absolutely, I've only heard some of the stories. I just can't believe. I mean, if the government ever say anything about mental health in this country, this is how we treat each other, and this is affecting the mental health of the people of this country. There's nothing more frustrating. I mean, first, it's trauma upon trauma. It's grief upon grief. So you've got the initial grief, you've got the grief of a sick parent, then you've got the grief of a parent who goes in to be cared for somewhere and then, isn't being cared for. That's another grief. Then the parent dies. That's another grief. And then the next grief is you look for answers and you want somebody to tell you what happened. And that's the other grief. And that grief, none of those griefs, you never deal with any of them because the last grief is ongoing. And some people are going to go to their deathbed with this is their life, and we are doing this. The government are sanctioning this treatment of Irish people or people who live in this country and are looking for care in this country. This is not care. This is the opposite. What is the opposite of care? This is it.
Did you hear? You probably saw as well. There was two fairly high-profile experts in geriatric care. I think that's the right way of putting it. I think there was a Professor Collins, and the name of the other doctor escaped me. They featured on the RTE documentary, and I think one of them used this is institutional abuse.
Yes.
That's, as an expert, that's what he has said about what's going on. Now, I mean, that should send shivers down the spine of Micheál Martin, Simon Harris, and all the rest of them. I mean, we all have parents or aunts and uncles, elderly, and we're all getting older. Is this what we're going to face as we all get older? This type of, I mean, as Majella Beattie said today, warehousing. I mean, it's almost like being put into a prison.
Well, for me, from talking to people whose parents died during COVID, it seemed like there was a decision made, rightly or wrongly. So maybe somebody felt they had to, but there was a decision made to let some of our population die.
Yeah, can I pick you up on that as well? Sorry, because there's so much. Again, one of the fabulous people there outside the door today, in the lashing of rain, I might add, and they were there in numbers, all supporting each other. They're just a fabulous group of people. And this lady, described a situation where a very high dose of fentanyl was suddenly introduced into her late mom's regime. And this caused a lot of, concern and fear amongst her and her sisters for her mom. And then they were questioning it with the nursing home. And the word DNR was mentioned down the phone. I think one sister didn't quite understand what that meant. The other sister did. And they discussed it. And it was, you know what that means. Do not resuscitate.
Yeah.
This was like, what? And this just came about at the end when this lady's health had very severely declined. And this is just before she was transferred to hospital, where she was subsequently diagnosed with sepsis when she got in there. And it was so, and she had very high grade ulcers, so much so that a nurse turned around to one of the family members and said, we think we should take photographs by way of evidence. But to go back, so the nursing home, without any consultation with firstly the patient resident, the lovely lady, and none of her family had put DNR into her records on the basis of, well, we've made a decision now that this is the way it's going to be for your loved one. Now that is outrageous. That is interfering with somebody's bodily integrity, which is a constitutional right in this country. There is no patient consent. The breaches, the trammeling of human rights, constitutional rights, legal rights, it's off the Richter scale in relation to that alone.
Oh my God. I mean, to make that decision to some, like it's still, this is your father, your mother, your sister, your auntie, whatever, going into this home. You don't have the right to decide. I mean, first of all, a discussion has to take place. And so, do not resuscitate from what? She came in with a
This lady was just,
or didn't want to come in the first place,
Well, she was at a certain age. I mean, my own mom, God rest her, as much as I wanted us to live together, and we did for a very short period, sadly. But my mom made a decision that, it was best for her to go into a nursing home. I mean, it absolutely killed me now, I'll be honest with you. I hate talking about it. But I just knew I couldn't be there, during the day. And Mom, unfortunately, was starting to have falls. And she's a very bright woman, very independent, but she knew that was for the best. So I suppose people go into nursing homes. They might be older or elderly and maybe a little bit frail, but it doesn't mean, that they don't have their mind and their ability to make decisions for themselves, and that, a sense of independence. But it seems that the attitude of these private nursing homes is, once you go in the door, once you've signed up, and once they're getting the money, let's be frank, once they're getting the money, they don't care.
Care, yeah. Take the word care out of the whole thing. The and I presume, and the staff are suffering. Yeah, this is traumatic for the staff, and nobody here is blaming the staff, and that's a big problem, because I presume the money isn't being spent on the facilities. The money is being spent on this. There isn't enough staff. So like, is this cost cutting? Are we losing loved ones? Or decisions being made like do not
thunder?
A truck or some kind. Are we losing loved ones to save a few euros?
Yeah. I mean, I'm glad.
Is a decision like DNR based on, well, we don't have enough staff because the board, whoever owns the company, mention any of them, they need to get their dividends? Is that what we're talking about?
I do believe so, and certainly. Having listened to Majella and the other ladies and gentlemen today, and speaking so powerfully, and I feel now more confident in saying it to you here. That's what I've always thought, and now I am happy to say it out, that this, as Majella said, is a model for profit, not a model for care. And another lady was saying that it's not acceptable to say we have staff shortages and we have this, that, and the other, because they have plenty of money to engage and hire and employ the people that they need. But it is cost cutting, and they're getting away with it. And that is the problem. And as you said as well, and I want to be fair, because it is not all the fault of staff. I know there was certain staff depicted in the horrendous RTE documentary, but if there's no proper staff training and there's no consistency of staff, there's no motivation for staff, there's no sense of, working together as a team, well, then staff are going to be demoralized. Staff are not going to care about their job. Staff are going to have no sense of vocation. So the problem lies with the owners of these nursing homes, the CEOs, the ones who are looking at the accounts at the end of the year and going, that's grand, as you say, we've got our dividend, tick box, move on.
And if you can draw a direct line from one of these patients where a decision was made to not resuscitate or just passed away and went in well, if for want of a better word, and very quickly, deteriorated and had bed sores and ulcers and sepsis, and if you draw a line, if you take one of those people and draw the line right back to, a member of a board that owns one of these companies getting a dividend, that money that's in their pocket, that's a direct result of that saving that they made for not having enough staff on to care for that patient properly. And I'm not going to use the words like manslaughter or any of those words, but if you're not doing what you're supposed to do to care for somebody and they die in your care and you've profited from this, I'm not a legal expert, but that doesn't seem like that's a good thing.
No, and thanks again, because you've just reminded me of something else that was said today, again, which resonated very strongly, is that in the UK, criminal liability has now been introduced in relation to nursing homes, residential care units. There's a similar organisation in the UK to HICWA. The name of it has just gone out of my head. It's something, anyway. But yes, there is now criminal liability on the statute books in relation to nursing homes, residential care units, respite centres, where if there is very serious failings, shortcomings in care established, they can be prosecuted. And you know what? That's what we need in this country.
That's what we need, and not the scapegoating of this one staff member who goes down for the death of a baby, or two. This has to be the owners. This has to be the owners and the people that are making the money, and only then will they start spending the money where it needs to be spending and do the care that they're supposed to do.
Exactly. Unfortunately, accountability in this situation, when you're dealing with large companies who are just in for the profit, the only way to hit them is in their pocket.
Yeah,
that's the only way.
Keith, I do want to talk to you about the hip operation stuff, but let's do it another time.
Okay. Yeah.
Thank you very much for your time. That was great, and thanks for all your work and for standing out in the rain today. And so there you have it. God, my haircut is severe. That's it. Thank you very much for watching. Talk to your local TDs about this. Demand better. These are the serious issues that are affecting the wellness of this country. And maybe you feel like there's something a bit off at the moment. That's what's happening. That's how we are treating our fellow citizens. So don't be distracted by the marches against immigrants. That's not the problem. That is not the problem. It is helpful for the government and the people who are creating the problems, like the board members of companies that own private care facilities. It's handy for them that there's marches taking place against something that isn't the problem, because that means there's no marches against them, the actual problem. Nobody's coming over here taking your jobs, but people are running institutions in this country with the word care in them, and they're not giving the care. And then there's no oversight. As a country, as taxpayers, as a government, we have no oversight. We cannot. Family members, there are times where they can't get in. This is not a COVID problem. There's times where they can't get in to see their loved ones. They don't know how they're being cared for. They don't know what decisions are being made. the staff are suffering as well. There's not enough staff. There's cost cutting going on. There's profits being made, big profits. The same with the IPAS centers. The immigrants aren't the problem. It's the people running these places who don't want to face up to the issues they're causing because they want to make more money because of greed. And we're allowing this to happen. And this is why we're feeling like things feel a bit off and we're looking for something to blame. We're looking in the wrong places. If you have a story and you'd like to share it with us, please do get in touch. You can follow us on X. A lot of people are watching this on X, at Moth News, Instagram at Moth_news. And we have our YouTube channel, which is Moth_news. And you can watch all of those interviews with family members, people who've gotten in touch. I've interviewed them here on the platform on Moth. That's the whole point of it. If you have a story and you want to come on and you want to tell us your story, if you don't feel like anybody is listening to you, you're writing to newspapers, you're writing to government ministers, nobody's getting back to you, nobody cares. If you feel like nobody cares and you have a story to tell and you want answers and nobody's giving you answers, come and talk to us and we will give you a platform. That's what Moth News is about, highlighting the actual issues that are holding this country back. Because if we don't do it, nobody will. The HSE is broken. The Children's Hospital, the CHI, is broken. It doesn't work. I mean, I don't know what the answer is. But we need to ask for better. For our children, for our women, for our elderly, for our men. And yeah. So there you go. Don't forget, every Friday we're live from 3 o'clock, bringing you the stories, the in-between the line stories that maybe you don't see normally in the mainstream media. And we're highlighting them. And we were doing these before the primetime thing that went out on RT, which was great. We had already started highlighting this issue. And we're definitely one of the first to bring you this latest big health scandal, which is probably going to be Ireland's biggest ever healthcare scandal, and we've had some whoppers, so it's pretty bad. Thanks for watching. Please try and go and have a cup of tea and a biscuit and enjoy your evening and put all this out of your head. Go to bed and be still here tomorrow. Don't watch too much news, and if you do, watch us here on Moth News. We'll look after you. Have a good evening.